in late May, Naomi Osaka withdrew from the French Open after she was fined $15,000. You remember, for not
Yes,
fulfilling the
yes.
press obligation. Well, she said that she was dealing with, depression and wanting to maintain her mental health and so forth.
Yeah, and she has a history of being shy. People know that about her. I don't know how a young person does that at that young age, have to go in front of that army of, and speaking into a microphone is stressful. I mean, anxiety is not getting less.
Yeah,
More people are starting to, come down with anxiety, or it's starting to be recognized a lot more than it used to be, that a lot of people have anxiety. And good for her for, saying, look, I can't do this. And and sometimes, they're not forcing things on her. That's the way it should be. I'm glad some people came to her defense. John McEnroe, the tennis,
John McEnroe came to her defense.
he
I'm
did.
shocked because he's always had choice words to say about the Williams sisters.
Oh, he has, because he did mention that Serena was the greatest tennis player of all time. He did.
He
Did say
said
that.
that.
He
That's
did.
incredible.
He was
Wow.
on some, yeah, but he backed her up. He said that he just felt like it's, the machine. Well, he's coming from a tennis perspective of the machine of sport being so huge, that it could really crush somebody, and that they're so young, and they're asking a lot, and how much of this is really necessary anyway.
With social media, you're afraid to say the wrong thing, because one wrong thing and then the media jumps all over you, and then next thing you know, you get replayed over and over and over again. And
Your
then,
worst moment,
right,
your
exactly. Or something is taken out of context and it's misinterpreted, and then that becomes played all over again and over and over. With this whole cancel culture, there's no escaping it, and that's a source of anxiety right there. So you've got,
absolutely. How many dumb things do I say dumb things all the time, my
yeah.
God. And what are the odds that
But
you're
you don't
thinking
have a mic in your face when you say it.
correct?
You're not saying
The
it and putting
pressure.
it,
Yes.
online for people to read and copy, and then it ends up, you know, and even Bindi Irwin, is taking a break
Oh,
from,
really?
yeah,
Okay.
for her mental health. Yeah, absolutely. Because you get a lot of that mental health burnout. But I also think, and tell me what you think of this. I think that the pandemic has tremendously increased um, mental anguish and anxiety and depression.
I
For
agree.
people, you know.
Do you think it's increased it because of secondary COVID, or do you think it's because of just the fact that everybody has been languishing, which is like, we're all stuck. It's been such a divisive time for in the last few years, and we can't go anywhere, and
I think it's all of those things.
fear,
Yeah,
and
I think it's all of those things. I think we are extremely divided as a nation and siloed. And by the way, no one talks enough about social media's role in this, but I don't want to,
okay, a story for another day.
that's a story for another day. Because what they do is they feed you more and more. It's like, well, based on this that you watched, we think you'll like this. And so what happens is,
The logarithm.
yeah, exactly, the algorithms.
Okay.
And it just brings you
Algorithm. I said logarithm. Okay.
well, that's okay. Further, further, and further, and further, and further, and further down these rabbit holes. And then people get siloed. And there's a certain sense of isolation in that. People are just like ready to snap, you know? People are so wound up. People are,
Yeah, that says anxiety right there.
yeah.
That people are so on edge.
Well, Lizzie, she's seeing somebody right now for anxiety because, for a year there was no school, and
That's
the
so hard on
school
kids.
thing was very hard. The Zoom thing was very hard because they're at that age where they need to be socializing and they need to be around each other. And we tried as a group to, have like social time with the kids where they're all on Zoom. It's just not the same. It's
They
not.
really need face-to-face interaction. They need to be in the presence. Otherwise, it's just flat image. That doesn't
Yeah.
mean the same.
Yeah. Yeah. So, so that's where, people are depressed because they can't hug loved ones. They can't see loved ones. Maybe you've lost people. In the medical community, there's a ton of,
PSD.
mental health. Yeah, because of, especially if you're a frontline worker, of all the loss, you know, not just of just people just dying every day and you can't help them in a sense of helplessness, but also losing colleagues. You're afraid to go home because you're afraid to bring this disease that you don't really know that much about to your family. You had people sleeping in their cars and, staying in hotels and so forth. But the sad thing for um, for medical providers is they don't have HIPAA protections like the rest of us do because of the nature of what they do. So they can't get mental health help.
Really?
Yeah. Because it could jeopardize their career, it could jeopardize their malpractice insurance, it could jeopardize their licensing, their certifications.
So you can't show any vulnerability of any kind or that you are having difficulty. You can't
No,
show
you
that.
can't get help. You can't get help. I don't know if they're showing signs of it, but you can't get help for it whether you are or not. And that's problematic. That the people that we rely on to take care of us cannot, are afraid to get help because of the stigma. They're afraid that their co-workers are going to find out and look at them differently. They're afraid that if they see somebody, they're going to be found out. Um, it's just such a mixed bag of, helplessness. I mean, what do you do with that? You've got anxiety disorders, depression, you got the bipolar, mood disorders, eating disorders. People have gained so much weight during
Oh, yes.
this time,
Yes.
just eating their feelings. And by the way, going back to Betty Broderick, that was the other thing that they showed she just kept eating her feelings. Every time she turned around, she had food in her mouth, she had bonbons, she was just continually, and then she blew up, she was just eating her feeling. And then don't forget about, the schizophrenia and other psychotic disorders, I mean, what do you do? Where do you turn? What can you do?
Yeah. How are they? What's been has there been more intake? I would think that it's making people who already have like low level, it must just be exacerbating everything, must just be magnified right now. Just anxiety is such a killer. I'm sure it's just really stoking everybody's existing mental illnesses and making them considerably worse.
Yeah. It's funny because
good luck getting coverage for treatment, by the way, other than maybe a little bit of talk therapy.
Really? There's no coverage?
Wow, good luck with that. You get of coverage because
I didn't think there wasn't. I didn't think there wasn't coverage.
Oh, there's no coverage. I mean, it's really shameful. The coverage is shameful. Like, for example, you might need first long-term talk therapy.
Mm-hmm.
You might get approved for 5 sessions of talk therapy.
All right.
But that's not necessarily, maybe that's for something that's emergent, but it's just anybody I know who has children with like significant neurodevelopmental issues or kids, that stuff's not covered by insurance. Sometimes medical aspects of it will be covered. For example, like a pediatric psychiatrist, if you're going and let's say your kid has ADHD, the medicine might be covered, but and within certain prescribed doctors, they might allow that. But if you want to get like behaviorist behaviorist, if you have that stuff's not covered. You
Oh
know,
my
it's
God.
just not. It depends on your insurance. And even with your insurance, they outsource mental health as a separate mental behavioral health is under like they have a separate company that they outsource for mental and behavioral health. So, for example, I think a lot of it also gets like lumped under like rehab for people who are going off to rehab. But if your kid has ADHD and, you know, all that gets put into one category and it's a whole separate other company and it's not covered by this big umbrella insurance company. They outsource all that stuff. You have to do everything separately. It's a different number. It's a different it's different everything. You have to do a completely different website and these two companies can't speak to each other.
Oh my.
It's forms and it's a lot. It's a lot and it's not covered. Also, you know, just simple neurodevelopmental things, ADHD, Tourette's, OCD, autism, these things aren't covered. And I'm sure lots of people have like low level or have like
Right.
sub threshold.
Right.
You know, anxiety is so pervasive now.
Right.
That,
Right.
you know, I
Almost
mean,
a catch-all.
it's a catch-all, right?
Yeah.
Yeah, anxiety NOS. That's like an entry level sort of.
Oh, okay.
Yeah, that would be an entry level sort of diagnosis that covers really a lot of stuff because almost everything has anxiety attached to it. And yeah, so
Wow. I had no idea. I assumed that these things were covered benefit. A lot of the providers, the mental health providers, they don't take a lot of insurances because I think because
right,
it's so flush with business right now, they don't
right.
need to.
The best ones almost never take insurance. They
Mhm.
just don't. And you know, if you wanted to go, let's say to a behaviorist, let's say your kid has ADHD or you know, which I'm familiar with,
Mhm.
250 for a 45-minute session. Not covered. Sometimes you might get partial coverage,
Uh-huh.
but a behaviorist wants to see your kid every week or they want to see you every week. I mean, it's not.
Are both of you covered under the 250 in that scenario?
Oh, sometimes they'll do a situation like you'll you know, they'll discuss a little bit well they'll discuss with the parent about the child in that situation. But you're not getting 2-for-1 coverage. That's not happening. You're not getting like both getting behavioral stuff in one session. That doesn't happen.
Whoa.
It's just you know, it's a bit of a shame. It's a big shame actually.
That's a
So
crying shame. Well,
yeah,
there's no wonder then that so many people are silently just in agony and quiet anguish and
and
acting
you have to
out.
fight for meds too, by the way. You have to fight for your meds. That gets to be problematic.
What do you mean
So,
fight for your
well,
meds?
for example, if your doctor thinks that this particular medication is better for you, you're going to
Mhm.
fight your insurance company. Just like a classic with other situations, the insurance company has very strict ideas of
Right.
what you know
They
how the
want to do
dosage
the
of the
generic. They don't want to do
right.
brand name.
They don't want to do brand name. Um, they want you to take you have to try all the other meds first before you find the one that works for you and that they actually cover. You have to exhaust all other medications, and some of these medications aren't necessarily great. So you might have, for example, a kid with ADHD is going through several medications before they find the one that fits. You know, that's all part of it.
Wow. That's
Yeah.
incredible. I'm not even sure what to say about that. I mean, I really
Uh,
just took this for granted.
ask any parent who has kids with special needs, or you know, they all know it. They have to navigate the system, and you know that's especially good for people who have like good executive functions. If you have a parent with ADHD or executive function a little off, it's harder to organize yourself and go through this maze. They don't really make it easy.
Mm.
So it's a whole thing,
So
you
only
know.
the most organized and tenacious.
Only the most organized and tenacious
It's
and
like
people with
exhaustion.
resources.
Yeah.
Right. And you know what you do is you can pay big bucks and you have some fantastic doctor who then also has a talent for advocacy. And then they set up, but it's very hard to get one person, even with a child study team, it's hard to get one person who's on point. You
Mhm.
know,
What's a child study team?
a child study team is, for example, let's say your kid has some learning disabilities and you want to get it evaluated through your school district. So
Mhm.
your school district, you will request your
Mhm.
child to have an evaluation. And so, for example, they run a bunch of tests, and the tests unveil perhaps that your kid has some dyslexia. And then the child study team, they'll have like a social worker, the school psychologist. It's all through the school system, but it has to be the quality of the individual school system. So if you are in, XYZ town, that particular PS23 is the school district that has to perform the evaluation on your kid.
Okay.
And then you have to go through this whole process called an IEP process, where if it's like individual educational plan, you have to get like, your kid has to get classified. It's just the whole procedure. That's a story for another day. I mean, that just takes up, but separately, if your kid needs any kind of therapy, I mean, how does that go about it for you guys when you need some therapy? Will your insurance cover
Well,
it?
for me personally, I
Mhm.
felt there was a period where I felt that I really was going to lose it, and I really needed to talk to somebody. Um, and I didn't really ask. I didn't really. I
Mhm.
started with. I started with trying to find somebody
Mhm.
because it was during the pandemic, and
Mhm.
uh, there wasn't, that like you're not going anywhere. You're at home,
Right.
so it's like trying to
Right.
find someone. And I just couldn't find with all these resources. I just couldn't find um, some place that. And also for me, I wanted to speak to somebody, a person of color.
Right.
And I just couldn't find that sweet spot of like, someone of color who would do it online, it was like, this whole list of things. So I never did it. Um,
Okay.
but
I
then I
heard
started,
online is taking off though. I heard a lot of therapy online is taking off.
right, but then you have to fill out this whole thing. And a lot of the questions that I felt like didn't really apply to me.
Okay.
I wasn't like in anguish. Um,
Okay.
you know, uh, some of the forms that you fill out, it's like, well, I don't really fall into that category. I don't really fall into that category either. That's, by the way, that's always been a problem of mine where I always overthink stuff. So it's, like
Yeah.
when I had to do the evaluation for Lizzie, it took
Uh-huh.
me a week because I'm looking at this. I'm like,
Oh yeah, I'm familiar with that.
is there
Yeah.
another category? Like this
Yeah, there
doesn't
should
really
be in
fit.
between
Yeah,
always
yeah,
and sometimes. There needs to be
yeah.
something in
Yeah,
there. Yeah.
yeah, and they didn't really have that. So, so for me, it was even more, nerve-wracking because I'm like, well, I
Right.
don't really fall into that category, but this doesn't really apply either. So I just never completed the process. Like I thought of doing like, I think one was called Talkspace, where you
Okay.
come to, and then I got very close, and then the hours didn't work out,
Mhm.
because they wanted to do it at like off hours. And I'm like, I'm working at that time. I can't just, drop what I'm doing.
Oh, that's another thing. Good luck getting that like after school or before school or
Yeah.
after work or before work.
Yeah.
Those are taken. Yeah.
So the person that she's seeing currently, what
Okay.
happened was, so I started looking for her, and I kind of started running into the same issue. But a lot of the issue I was running into was like, well, we don't see children that young. And
Okay.
I was just like, oh, okay. So they would check all the boxes, but then it's like, no, sorry, we don't see anyone that young. Teenagers, but no kids. I was like, ah, that's okay. So when I went to a pediatrician,
Mhm.
and she had her annual, and
Mhm.
I said, by the way, can you recommend anybody, because I really
Mhm.
think that she's got anxiety issues.
Mhm.
And it so happened that she had someone in her office that she had coaxed into having, because there was an article actually that I saw that was very interesting, that that pediatricians are not really seeing children for the bread and butter stuff anymore, but they're seeing a lot more requests for mental health. you know.
Okay.
Yeah, that's what they're seeing. That they're seeing a lot of that now. And I asked her, she's like, I'm so glad that you brought that up. Here, let me walk you over. And so she had somebody in the office and
Oh my gosh, that's like
I know,
fantastic.
manna from heaven. And she was
Yes.
like that she had begged her to come and put in some time in the office, that
Oh,
she really thought that it would. And that was actually her first day. That
oh
was
my
her first
gosh.
day. Yeah. So it worked out. So she
Did.
sees her, online once a week. And
Ah,
she works with her on, giving her like skills and assignments and goals and stuff like that. And it seems to be working. It's only been a few weeks so far, but I feel like it's helping me for sure.
okay.
Well, but in any event, she's seeing this
Okay.
person, and I'm grateful, because it's giving her. I mean, it's still early, and I don't know how many sessions that we're approved for. I keep not that I'm forgetting to ask her. It's just that she's trying to squeeze so much into that time.
Right.
I don't want to. I don't want to.
Take up that time chit
I don't want
chatting.
to take up that time exactly.
Right.
So I never get a chance. But I could just drop her a line and be like, by the way, how many of these are we approved for? And find that out. But it does seem to be helping.
I think that sometimes addressing something like a third party who's like them addressing, like a professional addressing something, it means something different than mom or dad doing it. And
Right.
sometimes that, yeah, like or a teacher addressing it, yeah,
hmm
it can be, it just has different meaning to kid.
But just the idea that this little one just had anxiety,
Yeah.
just kind of like breaking my heart, and then me
Oh,
and my anxiety, that didn't help any at all.
oh no, it no, no. Yes, yes. Nothing will give you anxiety like your kid having anxiety.
Yeah.
Yes, yes.
Well, I also think just the stress of, because everything was on me. You know what I mean? Like you couldn't order anything. I know that sounds really posh, but you couldn't order any because as a working parent, you rely a lot on like takeout.
Yes,
Someone to
right.
make your salads, someone to to make your burger, someone to make
Mhm.
your whatever, and deliver it to your door. And all of that was gone. And then everything in the store was all bought out. So I had to bake my own bread. And then,
Eh,
gluten free on top of that.
oh, yes.
So I had to bake gluten free bread. And then I had to make everything from scratch on top of my work. So
Okay,
my
that
days,
part's no fun at all.
so my days just became, and then there was like no outlet for any of it, because you're trapped inside, So I spent the first half of my day cooking and washing dishes, you
Three
know.
meals a day, is it two snacks? That's so awful.
And then
Never ending.
I'm up till midnight working because I had to spend my day,
You were
working.
exhausted.
And then, again, it sounds posh, but no cleaning lady, And so I had to do all of that myself. So it was, and I'm very anal about cleanliness in the
Mhm.
house. And it was stressful, and I really thought I was gonna snap. But, well, things are getting back to normal. And I don't have to, I mean, I enjoy cooking. I
Mhm.
don't like cooking when I have to.
When you
I
have
like
to, that's
cooking
a whole
because,
different
yeah,
story.
I like
Yeah,
cooking because I
it's
want
such
to.
a grind.
It
Otherwise,
is, I still have all this yeast and flour and all that. And also because I have to make my flour mix from
oh,
scratch.
you have to do yours. Yeah, I
It's
do
not
that
like
too.
you use the
So much.
all-purpose flour.
No, it's not.
You have to
You have to assemble it, then you have to
yeah,
refrigerate it. It's a lot of work.
yeah,
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 yeah.
So there was that. I'm glad that Naomi Osaka, and Bindi
You brought that up.
people,
Yeah.
are taking their mental health seriously and saying, I need to protect it. So I'm stepping away from activities that I find, are
She drew a
harmful.
boundary and did
Yeah,
a little, yeah, good for
yeah,
her.
yeah, yeah. I wish, more of us could do that if we even recognize that that's the thing. But
And
she
have that
recognized,
language. Yeah. Have that, know how to say that, have
yeah,
that language.
yeah. Do you think primary care doctors should be assessing people more now for mental
I
health?
think so. I think so. I know, like with my situation, with my mental health, the pandemic has been weirdly like good for me, but that's only because I have like anxiety in terms of like,
Social anxiety?
yeah, it's social anxiety. So now I'm not socializing. And then I don't know what happened. I don't know if it was just like maybe I just needed a break. And so now going out is not feel I'm so happy to be around people. Um so you know, I was probably less symptomatic. But when we get back to I think for some people, for introverts, maybe it was like temporarily a little bit of a blessing, but you know, a little bit. But it's still there was plenty of anxiety. It just wasn't the social variety. So,
Yeah. Where did you get started? Like, how did
oh, how
you?
did I get started? I got started like years and years ago when I was like a teenager. I
Oh,
did
okay.
like some therapy, and then I got used to like calling, going to see a therapist, and then I got used to that whole sort of system. But when
So
you
your
have to,
parents, so your parents did it for you first.
well, when I was in college, I went to see like counselor, like at the
Mhm.
college, and I remember like the counselor not really like, you know,
Oh God, I
I
remember
tried all
that.
those like help. I did all that when I was like, like a teenager. And then when I got a little older, then there was a therapist who was recommended to my parents. And I went to that therapist. And then my parents had phenomenal insurance
Mm,
because my dad was an oil company person.
right.
And that was like a 1980s package, and they don't have insurance like that anymore.
Mm.
And then when that insurance ran out, the therapist lowered her price for me, and I paid her, and she did a sliding scale because I was just
Okay.
a student, and so I saw her for years, and it was talk therapy. And now they would never cover anything like that now because it was so long. Talk therapy is the most expensive one of all, and it's psychotherapy in terms of like that old school where you go for men, long time, and that's really for the wealthy at this point, that kind
Right.
of therapy.
Right.
So she lowered her costs for me, but I don't know therapists who really necessarily can do that anymore.
Mhm.
She was charging me like $20, like really like lowered it,
That's
and then she said,
fantastic.
yeah, and then I would just
Mhm.
come up that I could come up, but that's like unheard of. I don't know any therapist. Once they do a certain amount of time, they're once they get to a certain level, they're like, I already did my charity work.
Yeah.
Now I'm going to my time is money, and and
Right.
there's too many people who need to come in. So
Right. I remember I went after my brother passed away. I went
mhm.
to the health center and I was seeing somebody.
Oh, so you went to the health center, right?
I
That's
went
how,
to the health
right.
center at school, at the health center
Okay.
at
Yeah,
the
through the
university.
school.
And uh, what can I say? The first person was very unhelpful. His body
Yes.
language was like he was just,
Doing you a favor or bored.
bored. He was taking notes and he
Yeah.
was like in the corner. He wasn't even facing me. He wasn't engaged. And I said that to
Yeah.
him. I said,
Wow, you
"What
called
am
him
I doing
out.
here?"
Good
Yeah,
for
I did call him
you.
out. I said,
Good
"What am
for
I doing
you.
here? Your legs are crossed. You're as if you're, protecting
He
yourself
was
from."
doing his time and you felt like he was just putting in his time and
He's
getting his
writing
like,
his notes. He's not even really listening to me, not actively anyway. And I said, "What am
that's
I doing here?
awful.
You're not." Yeah. And he just kind of froze because I don't think he expected, you know, some young
Somebody to
black
call him out.
some young black girl to
Good
call him
for
out the way
you.
I did.
I know I didn't call out the college person at all. I was just like, oh, they're falling asleep. I'm not gonna like
No,
I
I
just
wanted him to know where he was falling short and that I recognized that he was falling short. Like I wanted
good
him
for
to know his
you.
body language was not conducive to someone who wanted to help. And his lack of interest was apparent. So anyway,
All
I
through that
switched
body language. Okay.
yeah. Well, it was his body language. I mean, he was like this with his notebook and his legs are crossed and he's facing away from me.
Oh my gosh.
And I'm just like, dude, I'm right here. This cannot work. So I stopped. So that was, and here I am, I'm like with the tissue, I'm like dabbing my eyes,
Yeah.
and, because my brother had just died. And I just, so I didn't see him again. And I think I ended it early because it was just pointless. And I saw somebody else and she was wonderful. And
Ah,
she helped me so much to get back on track because I had to take a leave from school because I was just so distraught, that just imagine you're in you're getting into your second semester freshman year and you get a call from home that your brother died, you know? It was just a lot, so I'm glad I survived it. But that that really helped me.
wow. Good
Um,
for you that you said that. I would never have had the nerve. I
oh
wouldn't
no,
have
yeah,
had, like, I didn't have the confidence. Yeah, I didn't have the because I remember the school lady just like falling asleep, and I was just like,
she was
okay,
falling asleep.
yeah. She didn't seem to be paying attention. The body language, the same thing, and I
Yeah.
just was like, so then I just felt like shamed and embarrassed, and I just didn't go back to her.
You turned it in on yourself.
Of course, yes,
Yeah.
absolutely. That's how I am.
Yeah.
Yes.
Yeah,
Yeah.
I didn't see that as I saw that
Right.
like, how dare you?
Well, now I would be
Yes.
like, what's wrong with you? Like, but that's what I learned later with the quality therapist. I learned to speak up. Yeah.
Oh, okay. And so
Yes.
this next woman was wonderful, and she absolutely helped put me back on track, and I was able to get back into school. And my teachers were
Wow.
very, my professors were very gracious about giving me assignments and stuff like that to make up the semester. But it was a rough one, and I'm just really glad that I spoke up for myself. But then there was the other time I had some treatment because I was going through divorce number one.
Nothing. Oh, yeah. Those divorces. Ouch. They're so freaking painful. Just
Anyway,
fun was had by no one during a divorce. God.
I know, and that was my first one. So
Oh.
in any event, that was it was a nice local man, and he laid it out on the table, and he was just like he was much more. He was more like the woman that I saw in college. She was she listened and she repeated back, and she was like, "Oh, it
He
sounds
did
like."
all the clinical psychology type things. Yeah.
Yeah,
Or yes.
yeah. And and you work it out in your own mind, etc. This
Right.
guy was more like, I think you need to do XYZ. Here's
Ah,
which I needed at the time
it's
too.
very practical. Very
He's
practical.
very practical. He was like, it sounds like you've got XYZ. You need to do A, B, and C. And I think you should start doing it right away. And I was just like, and that helped also.
Yes.
So every style, depends on everything that's going on in your life. And I was able to take what he told me and turn it into some action. And because I was really at a point where, I was suicidal. Yeah, I was suicidal. And that's when I knew I needed help. I would work and then I would come home and I would be in bed from Friday
Yes.
night to Monday morning.
Yes.
And I would just lay there thinking about ways to off myself, to spite him.
Oh.
Yeah. And I was just like, what am I doing? What am I doing? I've got to get some help because, you have an idea of how something should be in your mind and then it doesn't,
That's that distorted thinking
yeah.
that
And then I
takes place.
started blaming myself for
Yes.
things that because
Yeah.
he was very good at making me feel like it was my fault, his bad behavior. Yeah.
Pure gaslighting. That's torture.
Yeah.
Torture.
And so I was turning it in on myself because I was just so angry that I was just like, you know what? I should just off myself and then let him come home and find me that way and traumatize him forever. But then I thought about my family. How would my family feel, if I did something like that? and they don't have the means to bury me right now, you know. So I said, you know, I've got to pull myself out of this. And he was fantastic. He was fantastic. He called it out right away, and he was like, "This is what you need to do." And I did that, and we ended up getting divorced. And that was one of the best things that ever happened to me. And also that took the stigma of shame, you know, of, you know, failure for relationships and all that. That took that away from me.
That guy did not, he knew what he was looking at and did
Yeah.
not,
Yeah.
he didn't buy into that stigma whatsoever.
Yep. And that really helped me, you know. And I keep going back to Betty Broderick. You know, if only she had somebody to do that for her and
To
like
tell her exactly the order in which to do
yeah,
things.
yeah.
And
But
you
then
know what
there's
you
also
need?
that thing that she was stuck in this cycle
You
too.
were also capable of hearing it. You weren't
Well, yeah.
that.
Well, because I thought that's what it might be, but I didn't have, you know, an outside party to verify it for me. Because I was
Yes.
just going by what he was telling me. And he's like, "You're crazy,
You
and you don't know what
needed
you're
to be
talking about.
heard.
And this is on you." And you know, and you know, I'll tell you offline the details of how that whole thing went. Actually, I think I told you this before. But you know, he was blaming me for his bad behavior. And it was crushing me. It was killing me, you know, because I started feeling like, well, maybe there is something wrong. And then I was just having this
It
inner
gets in your
turmoil
head.
with
Yeah.
myself, where I was like, well, how can this be my fault? How can this be my fault? I haven't done anything wrong. I don't understand how this is my fault. And so I'm having that internal conflict with
And you're confused.
and I'm
They're
confused. I'm
confusing you. That
angry.
smoke screen.
And
Yes.
I'm feeling like a failure because the marriage is not working out the way I thought it would or should. And you know, it just took a mental toll on me. It took a serious, strenuous mental toll on me. I started gaining, you know, a lot of weight,
Mhm.
you know, and you know, that was anyway. So that doctor, he was the best, and he really he literally saved my life, you know. And you know, I dropped him.
The right help at the right time.
And I can't stress enough how important that stuff is, you know, to have to seek help, know you need help, and get help, because it could really mean the difference between, you know, your survival or not, you know. And I'm not just talking about the basics like food and, but you know, the mental or psychological survival, right? Because that's important too.
The will to survive, the will to thrive, the will
And your
to live, all those.
self-preservation. Yeah.
Yes.
Yeah, absolutely. Yeah. So much so for that trip down memory lane. But you know,
Woo.
saying all of that to say that, you know, therapy is good. You don't keep it
Yes.
in.
It made a difference in my life. It was life changing.
Yeah.
Yes.
All right, my darling. Well, it was
All right, my
wonderful
dear.
talking to you. Thank you so much. And I will see you
Mwah.
again next week.
All right. Ciao.
Bye.
Bella. All right. Bye.